6 months ago, I started orthodontics residency. I had just graduated from dental school, was stepping into my new era as Dr. Eli, and was truly excited to further my knowledge about orthodontics. In dental school, I was able to get my start on my orthodontics journey by taking Invisalign patients, and honestly, I thought I knew a lot, but I didn't know how much more wrong I could have been. So now, I'm 6 months into residency, and I want to talk to all the pre-dents, dental students, and dentists out there. If you're thinking about specializing, this is the video for you.
What's up, everybody? My name is Dr. Eli, and I am a first-year orthodontics resident that just graduated dental school in 2025. Being 6 months into residency, I have a new perspective on working in dentistry, specializing in dentistry, and even attending dental residency in general. Now, while we're in dental school, or even before, or even after, we often ponder the thought, should I specialize? And now that I'm 6 months into my residency, specializing in orthodontics, here are my honest thoughts. So before we get into the video, I'll just talk a little bit about why I chose to specialize, in case you haven't seen some of my other videos about my specializing journey and all that other stuff. So I chose to specialize in orthodontics because I was originally attracted to orthodontics before I was attracted to dentistry. When I graduated from college, I was pre-med, and I decided to start working, and I went and got orthodontic treatment for the second time in my life, this time as an adult. During my second treatment, I met a really good mentor, but I also just fell in love with the process of my braces. I kind of obsessed over it. I feel like most people always wonder, well, when am I gonna get these things off? And in my curiosity, I ended up finding things about braces and just learning about the process, and it really made me interested in orthodontics. And so, you know, being a pre-med student in undergrad, I already took all the prerequisites, and I was already along the path to applying to medical school. The only difference really was that I needed to start shadowing and take the DAT. And I shadowed a general dentist because I wanted to make sure that if I was pursuing dentistry, I was interested in general dentistry and not just orthodontics. Luckily for me, everything ended up working out, and I went straight from dental school to residency, and now I'm 6 months in. So I will say, going into residency, I was pretty naive. I knew a few residents, but everyone's at different programs, and different programs are different. A lot of people are too busy to really get a clear idea of what their day-to-day looks like, and there aren't many Dr. Eli's on YouTube that show the real life of a resident, or when I was in dental school, a dental student. So I thought residency was going to be a lot like work. You go to work, you go home, you don't really have homework. Everything that you learn, you kind of just apply, and that's how you reinforce the information. I really didn't expect it to be like school so much, or like dental school. And to be honest, right now I still kind of feel like residency is harder than dental school. But just to show how naive I was, I genuinely had no idea how busy I would be. And I wouldn't necessarily say there was anything that pushed me away from general dentistry, because I really enjoy general dentistry. Like I said, I made sure that I was interested in it before I applied to dental school. And I would have been totally fine if I decided to pursue general dentistry as well. I just had that burning passion inside me that wanted to learn about orthodontics, and I felt like I could relate to the orthodontic patient more and the patient population, so that's why I chose to pursue it. But let me tell you something, it is a hard choice to make. And if you're a third-year dental student watching this, or maybe even a pre-dent, for a long time I struggled with deciding whether I wanted to pursue a specialty or not. And we'll get more into why I think you should or shouldn't later in the video. But trust me, if you're someone that feels that way, this is the video for you. So of course, I don't have the experience to talk about what all the residencies are like, but let's talk about what ortho residency is really like now that I'm 6 months in. So the way that my residency is broken down, and I will say my residency is a little more rigorous and fast-paced because it's a 2-year program with a master's. But essentially, the way that we are set up is that our first year, we have class all day on Monday, 8 a.m. to 4 p.m. through lunch. And the rest of the week, we have class pretty much from 8 to 9 or 7:30 to 9, and then we have clinic from 9 to 5. During the second year, on Mondays, you have most of your Mondays free to just work on your research, but you also have a rotation on Monday afternoons every other week. You work with patients with craniofacial anomalies, and once every 7 weeks, you go to the hospital to work with patients with craniofacial anomalies there. The rest of the week, you have seminar classes from 8 to 9 a.m. or 7:30 to 9 a.m. and from 9 to 5 you have clinic. The second years have 2 columns of patients, so their clinic workload is a little heavier than the first years, but essentially you have a good balance between class and clinic, mixed with seminars, grand rounds, and all that stuff. Now, you're training to be a specialist. This goes across all the specialties, whether it's ortho, perio, pros, all those things. You see the complex cases because that's what you are going to deal with in the real world. And this goes with all specialties because endodontics, we learn how to do the root canals in dental school. Prosthodontics, we learn how to do crowns and dentures in dental school. But as the specialist, you see the cases that the general dentist can't manage. You see the cases that the general dentist might mess up and now you have to fix it. So we are seeing the complex cases while in residency. You have a lot more responsibility than dental school when you're in residency. You are the doctor. You have a different level of knowledge than you did when you were in dental school. So you have to make decisions. I think I was naive about how I would be treated in the clinic now versus a dental student. There are times where you will have to use your clinical judgment to make a decision without a faculty. And you have to make the right decision because you did learn how to be a dentist when you were in dental school. There will be times where you have to do things on your own and you can't lean on your faculty. Although you are in a learning environment, sometimes you have to take the responsibility to do certain things. There is a much higher level of independence when you are in residency. However, it is a learning environment, so you do have that crutch of having faculty there. Residency is also a steep learning curve, and I will definitely say that. Most dental schools don't teach much about orthodontics, so when I got to my orthodontics residency, I felt like a baby that was just learning how to walk, talk, swim, and all that good stuff. I knew nothing. Now that I'm 6 months in, I do feel a lot more knowledgeable, but I'm also cognizant and aware that I have a long way to go. And I'll be honest, I think one thing that shocked me about residency is that it opened my eyes to how much I didn't know. I feel like coming out of dental school, especially a dental school that allowed us to have our own Invisalign patients, I could handle some Invisalign cases, and I still feel like I can now. However, there is so much about orthodontics that I just did not know until I got to residency, and I did not know that I did not know it until I got to residency. And if you're looking for more day-to-day life of an orthodontics resident, please feel free to check out any of the vlogs that I've made during my first semester just to get an idea of what my life generally is like as a dental resident. And you can go back to my dental school vlogs to compare it to how my life was as a dental student. So these are the hardest parts of being a resident that no one talks about. I'm gonna give it to y'all straight. Number one, although you're a doctor, although you've already graduated from dental school, sometimes you still feel very small. And I'll just be honest about that. And I'm not saying it in a way that your faculty will make you feel small or that you don't feel like you're in the realm or the area or the position to speak up for yourself or to trust your own clinical judgment, but you are still in that learning role. You don't have as much freedom as you would like to have as someone who has graduated dental school, who has the title of Dr. Blank, who has the degree. You won't always feel like that. And that can be hard to deal with, especially after you feel that you've worked so hard to get to where you are right now. For example, you get exhausted having to make decisions and then having them turned around because a faculty says this is the way to do something, or this is the better way, or this is the way that I like to do it. It's frustrating and humbling to feel like you are bad at something again. Because in dental school, you start off not knowing anything, you start off bad at everything, and you get better. And then when you graduate, you get to the point where you have felt confident and you're ready to go out into the world. And then you get to residency and you sort of lose that confidence. It can be very tough to deal with. You get into a new world of people. You have co-residents that come from all different backgrounds, different dental schools. Some may have worked for years as a general dentist. You all have different knowledge levels. And you can sometimes feel like you're behind or that you're not as smart as them, you don't have as much experience as them, or whatever it may be. And that's tough too, that's hard too. Another big one is not having an income and missing out on life for extra years after you've already done that for 4 years in dental school. A lot of people, put their lives on hold for dental school. They don't get married yet, or they don't have a family yet. And then after graduating dental school, you feel like now is the time where you can do all that. But unfortunately, if you're gonna specialize, you gotta put life on hold for another few years. That means you probably just can't. I'm not saying you can't, because people have done it, people in my program have done it, but it is really hard to have a kid and manage a newborn as a resident. Probably even harder than it was in dental school. If you're at my program, you have to be there Monday through Friday, 8 to 5. There is no leaving early, even if you're twiddling your thumbs. And that can be tough, because for the people that do have kids, it makes it hard for them to feel like, wow, I could really be spending some of these precious moments with my child right now, my newborn, my toddler. That's kind of tough to deal with and to accept. But if you're gonna be in a specialty and attending residency after dental school, even if it's a general practice residency or AGD, that's something that you're gonna have to deal with. And I think that these are just things that I didn't fully understand before residency started. And I'm not even really saying that they directly affect me, but they are things that you should think about if you're considering stepping into the role of a dental resident and applying to different specialties. Now, although I've given you guys all my honest thoughts and why I think that there are some things that you should consider if you want to specialize that you may not be thinking of right now, but now that I'm 6 months in, I can warn you about, I do want to tell you about the good parts of being a dental resident. Now, don't get me wrong. There are a lot of things that I'm missing out on. There are life events that I have to miss out on, friends' birthdays, friends' weddings, and things that I just can't be a part of because I'm on a journey right now. But there are very, very beneficial parts of this journey as well. And I'd be remiss if I didn't mention that while mentioning all the other things that I have. So the best thing for me about being an orthodontics residency is that, one, I'm in a place that I always dreamed of being. Orthodontics residency is one of the hardest specialties to match into coming out of dental school. And there are people who pray every day to be in my position. So I'm grateful and I'm thankful, and I do not take my position as a resident for granted. I'm doing the things that I've only dreamed of doing. I get to see people change right before my eyes. I get to see the same patients along their journey, from how they come in and being not confident about their smile or their speech or their facial aesthetics or whatever it may be, and I see them open up as time goes on. Out of all the patients that I have in active treatment right now in my residency, it's so cool and interesting for me to see middle school age kids. There are a lot of changes going on during middle school. A lot of people are coming into their own. They're learning how to be social and personable. And there's so many kids that I see that come in that are so quiet. And then they get their braces and their teeth start to change, and they become so outspoken, so outgoing, so personable. You can see the changes that it's having on their social lives. And it's amazing to see, because I remember being that kid before. I feel so aligned with my career, and I feel that my career as an orthodontist aligns with my lifestyle. Someone that does YouTube, someone that can relate to kids, someone that can relate to teenagers. I feel that I'm right where I need to be, and I'll never take that for granted. So there are definitely good things about being an orthodontics resident, and for the people that are interested in other specialties, whether it be pros, perio, peds, OS, there's a lane for everybody that's interested in it. And I'm now at the point where I can realistically see what my future is going to look like, lifestyle-wise and money-wise. I know what my future is shaping out to be, and there's only a finite amount of time until I'm there. I'm 6 months in, I got 18 months left, and I have something to look forward to. So don't mistake this video as being my way of pouting or telling you not to do it. This is just me giving you the reality, the bad side and the good. Is it worth it? I think it's worth it if you are truly interested in it, but I don't think it's worth it if you're just thinking, well, I have good grades and I can make a lot of money, because you will be miserable, trust me. So here's my advice for anyone that's watching this video that's thinking about specializing after dental school, or if you're already graduating from dental school and you're thinking about going back to specialize. Number one, shadow before committing. If you're at a dental school and you have the specialties at your dental school, first year, second year, third year, fourth year, it doesn't matter. You need to be going to those departments even if it's in multiple different departments, and just seeing what they do on a daily basis and seeing if you truly enjoy it. You will save yourself a lot of time, effort, and money on the back end if you figure things out now as a dental student without going through the process of applying and being denied or accepted and getting in and then figuring out it's not really for you. I would not recommend specializing as your way of escaping general dentistry. I know a lot of people, especially people that have graduated dental school already and are in dentistry working as general dentists, feel like this is not something I can do for the rest of my life. I get that, but I would recommend finding a good mentor in general dentistry and carving your own path in general dentistry rather than seeking out ways to specialize just because you don't want to be a general dentist anymore or you don't like the lifestyle of general dentistry anymore. Think about the debt and the time commitment that it's going to take to get to the end of this road. If that's something that you're not willing to take on, especially with the way that the world is changing now, I would definitely say that takes a lot of thought because that is a big part of specializing, especially in orthodontics where a lot of programs charge tuition and they don't really pay. Think about it this way. Specializing does not make your life easier. It just makes your journey more specific. So would I still specialize if I had to do all this over again? 100% yes. But I would have liked to know all these things beforehand. I will say that because it was somewhat of a rude awakening. So thank you all for watching this video. I want you to be honest in the comments. Are you thinking about specializing? What reservations do you have about specializing? Do you have any extra questions for me? Drop them all in the comments and I'll do my best to answer whenever I see them. If you enjoyed this video, please make sure you subscribe to the channel. Please make sure you drop a like under the video as it helps boost the engagement and boost the views of the channel to people that may need to see this video but haven't heard of the channel just yet. And of course, if you're interested in more nitty-gritty details about what orthodontics residency is like on a day-to-day, go check out my ortho residency vlogs playlist. And if you are interested in how to become a good applicant for residency or what to consider when you're finally sure about applying to residency, I have another video that I'll put in the end card of this video that you can go watch after this. It's called Watch This If You're Thinking About Specializing in Dentistry. And I hope you get some good information from that as well. That's all I got. Thank you all for watching. I hope to see you in the next video. Peace. I got baguettes in the back of my ring and I went he trying to hit me. I told her she gotta run to the team before she can talk to the lit. Before she can talk to the jet. Yeah. Lamb chop, I just pulled up.